What We Should Know, coming to you from WCCR, Voice and Vision of Cambridge, Massachusetts. The view is apparent directly out of our studio window on the left-hand side, right-hand side of your screen. Today's program is going to be about the National Nurses United, a national organization supporting Bernie Sanders and supporting single-payer health care. For the first time in the last 20 years, the Democratic National Convention, this time in Philadelphia, failed to accept a single-payer, universal health care as a plank in the platform of the Democratic Party. The reality is that Hillary Clinton supporters gave the vote in majority, ruling out the possibility of accepting the plank into the party platform for the 2016 November election. The unfortunate choice by Hillary Clinton, again, she's made so many unfortunate choices, this time ruling out single-payer universal health care as a plank in her ostensible support for the working poor, support for mothers, support for the blue collar, support for women, support for families. Clinton is a complete disaster. She lies, she repeatedly lies, she distorts reality, and she did it again in refusing to accept Bernie's demand that single-payer universal health care become part of the Democratic Party plank for the 2016 election of Hillary Clinton as the nominee for the Democratic Party. This entire scandal is on the back of Hillary Clinton. And that is what today's program is going to be about. The fact that National Nurses United went into the negotiations in the Democratic National Convention to work through the reality of getting the plank of universal single-payer health care into the party platform for the 2016 election. The Clinton faction voted down this opportunity, and for the first time in 20 years, this plank is not part of the platform of the Democratic Party. Instead of that, it's the Obamacare, which is scheduled to increase in California its costs by 14% in this year. As you know, there's a coverage, a very expensive coverage, much better coverage than was the case without Obamacare, but much worse than having a single-payer universal health care in which every individual in the United States, living in the United States, is covered 100% by health care and for a very low premium, $55 or so a year. This is the reality of the scandal of Hillary Clinton, who never should have won the nomination. Her stealing of the election, her stealing of the primaries, her stealing of the caucuses, and misrepresentation of hundreds of events, stealing of votes in major swing states throughout the United States during the caucuses and primaries has been documented. And the reality that Sanders garnered 46% of the popular vote, a difference within the margin of error between Clinton and Sanders. But there was no way that this information was going to reach the public public until the scandal broke of Debbie Wasserman Schultz having to lay down her position as head of the Democratic National Convention due to the scandals, email scandals, which broke shortly before the beginning of the convention, showing that she had manipulated the election in caucus after caucus, in primary after primary. But without further ado, let's have this piece about the Nurses United endorsement of Bernie Sanders.
Let me begin by thanking the National Nurses United. And I want to thank you not only for the work you do every day, saving lives and keeping Americans healthy, but because you are doing something above and beyond that. You know that in order for you to do your jobs in the way you were trained and want to do your jobs, we need radical transformation of the American healthcare system. And you know that you cannot keep America healthy if people cannot go to a doctor or a nurse when they need to. And you know that tens of thousands of people every single year are dying because they do not have access to healthcare. And what you are doing above and beyond the hard work you do every day, you are standing up and fighting and demanding that every American has healthcare as a right, not a privilege. I'm going to say a few words in a moment, but I wanted to introduce some people who, on a daily basis, are working amidst the healthcare crisis in this country, and I want them to reflect on what they see and where they want this country and the state to go. And let me begin by thanking Dr. Bill Honigman, who is an emergency room physician who is working in the midst of the health crisis every day. Bill, come on up and say a few words.
Thank you. Thanks everyone for being here. I'm Bill Honigman from Orange County. I'm a practicing physician specializing in and board certified in emergency medicine. I'm also a longtime Democratic Party activist and an organizer with the grassroots group Progressive Democrats of America, PDA. Among the critical issues facing America, access to quality health care remains a top priority for everyone in this country. Preventable deaths and such indicators as infant and maternal mortality rates have only been partially mitigated since the Affordable Care Act. More than 1 million U.S. households, even now, are expected to declare bankruptcy annually due to personal health care costs, and studies predict about 75% of those households will have had health insurance at a time, it failed them at a time when they needed it. Bernie Sanders understands, as do the rest of us in the movement, that a single-payer, expanded and improved Medicare for All system would save money, not cost more, and save lives. It's the bold move forward that's needed toward resolving this crisis. As President of the United States, Bernie Sanders will continue leading toward this end, not just from Washington, D.C., but in cities and communities from coast to coast, in the massive involvement of all those affected, meaning all of us. In fact, the political revolution that Senator Sanders often describes is exactly what would be needed to transition from the current profit-driven consumer model of healthcare delivery to the just system that we need to ensure that everyone is provided for and nobody is left out. And then, as a practicing emergency room physician, I just want to say I see those affected by the crisis every day. I see people who fall through the cracks, who can't get to see a doctor, who refuse care, can't see a dentist, and end up settling for the most expensive, most inefficient, and desperate measures that can be offered in the emergency room. I know based on this personal experience, as well as the published information on American healthcare, that Bernie Sanders is exactly the leader and the president we need to bring about this change. Thank you.
Now gives me a great deal of pleasure to introduce Deborah Berger, who is the co-president of National Nurses United. Deborah?
Good morning, everyone. As you know, I'm president of National Nurses United and the California Nurses Association. And it's always a good thing when National Nurses United and Bernie Sanders share a platform, because it reminds us of how much we share in common. Over many years, we have organized together for a people's agenda based on our shared values of caring, compassion, and community. For nurses, that means standing up with your patients to demand guaranteed health care for all. And Bernie Sanders stands for that same principle. Health care is a human right. Plainly stated, each patient deserves the health care they need rather than receiving only health care they can afford. Bernie Sanders understands the anguish of our patients who can't go to the doctor or who are sent home without the help they need after a hospital stay, or who pay higher and higher costs, have limited choice of providers, and huge prescription drug bills. Nurses see patients return to the hospital because they had to split their pills in half or didn't even fill the prescription because they couldn't afford the high cost of the drug. We see families bankrupted because their child confronts cancer, and we know it doesn't have to be this way. We know that. So does Bernie Sanders. He gets the human impact of our patients' delayed treatments and denied care, and he does something about it. Bernie Sanders won $11 billion for community clinics in the Affordable Care Act, a signature achievement. This significantly expanded access to care for poor and working class families. And it was Bernie Sanders who wrangled with the GOP majority to secure $15 billion more for our veterans' health care. And during the health care fight, he also was leading in the Senate to make sure that there was guaranteed health care through a single-payer improved Medicare for all system, and he won't give up on that fight. Nurses know we cannot provide care for the patients we need, and we know who to hold accountable, and that is the insurance industry and the big drug companies. Leading in Congress, joining with us and with our patients in that effort, has been Senator Bernie Sanders. Bernie Sanders stands with us on safe staffing in our hospitals, advocating for the number of patients assigned to each nurse, and for utilizing the clinical judgment of nurses and doctors to make healthcare decisions rather than the bean counters in the healthcare industry. Bernie's plan to expand and improve Medicare for all would enable nurses to provide the care for our patients in need, as it saves money by eliminating waste and redirecting spending and profits back to patient care where it should have been all along. So it's really easy for nurses to say to voters, Bernie Sanders would dramatically improve the health of the United States. Nurses proudly stand with Senator Bernie Sanders to demand that we guarantee health care for all as a human right. So sisters and brothers, members of the media, it is my honor to be here today to work with Senator Sanders to take back our country and make sure that we do guarantee health care as a human right. And I just want to say thank you to Senator Sanders, who is the next president of the United States.
Thank you. Thank you. Okay, now, let's hear from our third speaker, Dr. Hank Abrams, who is the board president of Physicians for National Health Care Program.
Thank you. For decades, our country has been locked into an exorbitantly expensive yet wasteful healthcare system, a system that fails to provide access to any care at all for millions and leaves even more folks sacrificing their savings to get care that is often delayed. As you have heard, everybody acknowledges this, but only one candidate has a plan that can gain our legitimate right to health care, a plan that's medically much more effective and economically much more responsive than what exists now. 25 years ago, the Journal of the American Medical Association published an article describing a national health program that, quote, would cover all Americans under a single comprehensive public insurance program without co-payments or deductibles and with free choice of provider, end of quote. Some call it single payer, but often it's just called improved Medicare for all. Most folks say they want it, and most doctors say we need it. And nurses, there's no question what they say. So why don't we have it? I'll tell you why. Because special interests have put a stranglehold on legislation to reform health care. That's not fair. In fact, it's un-American. Senator Sanders wants to change that, to restore control of health care to patients and their doctors and nurses and other caregivers by breaking the stranglehold of giant corporations and enacting an improved Medicare for all. Don't be fooled by other candidates who propose fiddling with the current system when it's clear that it can't be fixed. Be smart. Vote for Bernie and candidates for Congress and the state legislature who are committed to fighting for improved Medicare for all.
Yes.
And I hope my medical colleagues, family, friends, and neighbors will join me in voting for Bernie so we can finally fix our broken healthcare system. Thank you.
Let me thank Bill and Deborah and Hank, not only for the work they do every day to keep us healthy, but for their understanding that if they and all of you are going to do your jobs well, we need to guarantee health care to all people as a right.
That's right.
Now, let's take a look at what in fact is going on in America and what is going on in the world. Embarrassingly, the United States today is the only major country on earth, the only one, that does not guarantee health care to all people as a right. That's right. You go to Europe, you go to Scandinavia, I live 50 miles away from Canada. Health care is a right for all people. Now, I worked on the Affordable Care Act, and I think it has made some significant improvements. but clearly it has not gone far enough. How can we be satisfied when 28 million people in this country today have zero health insurance? How can we be satisfied when even more, and that number is growing every day, are underinsured with high deductibles and high copayments? So what does it mean in America if you have no health insurance or if you are underinsured? Here is what it means. It means that when you get sick, you may not go to the doctor or nurse to get the care that you need. And what happens if you don't go and get the medical care that you need? You get sicker. And sometimes you die as a result of that. I have talked to doctors and nurses in Vermont and all over this country. And what they tell me is people walk into their offices much sicker than they should be if they went for medical care when they needed it. So our job is to say that if you're sick, go to the doctor, go to the nurse, get the medical care you need when you need it. Don't wait a year. And sometimes when you walk in, the doctor or nurse will say, it's too late. It's too late. Your situation is terminal. That is inhumane, that is insane, and that is not what should be happening in America.
Right.
And by the way, the result of that is that some 40,000 people a year die unnecessarily because they're getting the medical care too late, because they're underinsured or they have no health insurance. 40,000 people a year. Now, somebody may say, well, you know, Bernie, you're right, that's terrible, but at least we run a cost-effective healthcare system. You know, if you're not spending a lot of money, you're gonna have problems. We are spending far, far more per capita on healthcare than the people of any other nation. In the United Kingdom, where everybody has health care as a right, we are spending almost 3 times as much as they spend in the UK. We spend 50% more than the French spend. Everybody has health care there. And we spend significantly more than you do in Canada, where everybody has health care. Now, on top of the health care crisis, but part of it, is the crisis in the cost of prescription drugs. Okay? Now, you want to talk about crazy. And we can go on in talking about crazy and dysfunctionality in the American healthcare system. Think about this one. 1 out of 5 people who walks into a doctor's office and gets a prescription cannot afford to fill that prescription. Now, how insane is that? You get a diagnosis and you can't take the medicine that you need in order to treat your illness. All over this country, and I've talked to these seniors in Vermont, elderly people are cutting their prescription drugs in half because they cannot afford the medicine that they need. Meanwhile, if we talk about crazy, last year the top 5 drug companies who charge us the highest prices in the world, millions of people in one way or another get their medicine from Canada because the cost of medicine in Canada is substantially lower. That's crazy. But what is equally crazy is last year the top 5 drug companies made $50 billion in profits. You want to hear crazy? This is just a partial list. I don't want to go on forever. Between Hank McKinnell Jr. was Pfizer's CEO from 2001 to 2006. Pfizer, one of the large drug companies in this country. He received a golden parachute when he left Pfizer, worth an estimated $188 million. Okay? People cannot afford the medicine they need. 5 major drug companies make $50 billion in profits last year, and 10 years ago, a guy who works for Pfizer receives a $188 million golden parachute. Frank Hassan, the CEO of Merck, from 2003 to 2009, received a golden parachute worth an estimated $189 million. So it is criminal. It really is criminal, because what do we say if somebody dies or get much sicker than he or she should be because they cannot afford the medicine they need. What do you say about that? It is punishing somebody. It is hurting somebody. I think it is criminal. I think it is criminal, and that's why all of us and all of you are fighting to make sure that every American gets the health care, comprehensive health care that he or she needs. And by the way, when we do that, we save middle-class families substantial sums of money, because we have the most wasteful, dysfunctional system in the world. There are studies out there, the numbers go up and down, but there are studies out there that if somebody goes into, for example today, a community health center, the cost of that person going in for treatment is 1/10 the price. 1/10 the price they're going in to Bill's emergency room. And yet how many millions of people now have no other access to health care but going to an emergency room, which is the most expensive primary health care in the country. So we've got a dysfunctional system, and we are going to change that system. That is what the American people want. We are going to take on the private insurance companies. We are going to take on the drug companies. The function of healthcare in a democratic, civilized society is to provide quality care to all of our people in a cost-effective way, not to make billions of dollars in profits for the drug companies or the insurance companies or golden parachutes of $180 million for some CEO of a drug company. Thank you all very much.
The interesting part, of course, the interesting part about Bernie Sanders' speech is the truth of it. Sanders clearly recognizes the necessity of single-payer, universal health care as a right, and campaigned vigorously for single-payer health care. But as we mentioned at the beginning of this program, was defeated by the Clinton negotiating team, who refused to accept the plank in the Democratic platform for universal single-payer health care. In favor, that's Clinton's suggestion and what her group forced into the party platform of Obamacare, which is not as effective, much more expensive, doesn't cover almost 40 million Americans, and is much more expensive, and is not a right, but rather has to be registered for, applications made, whereby universal single-payer health care is seen as a right. If it were accepted, it's an extension of Medicare for every individual 65 years of age who has paid into the system gets Medicare, and there are probably over 60 million individuals in the United States with Medicare. The idea would be to expand Medicare to be the single-payer, universal healthcare system for all Americans. It's cheaper than the costs that we are now giving for Obamacare. Less than half would be the costs. We're giving more than twice what the European nations are giving for their single-payer universal health care systems per capita. So we know that our system, the system in the United States, is not as effective, eliminates 40 million Americans from health care, and charges much more for the premiums, for the pharmaceuticals necessary to recover from an illness, and the health care is not available universally to Americans. This is a system which needs to be accepted, and we suggest that in the primary, that in every opportunity, the Democratic governors, those writing, campaigning for our votes should be told clearly that they should support universal single-payer health care as a right in the United States, and we should work vigorously to get Bernie Sanders as the candidate for the presidency in 2020, if necessary, with a battle against Hillary Clinton, should she get elected. So the reality that we've just seen is important, but we also have another question, which is important to us here at Peaceworker Radio and at What We Should Know. It's the idea of the authoritarian personality. It's become obvious that the candidate for the Republican Party, Donald Trump, is a bully, a bigot, a racist, and an authoritarian, has an authoritarian personality, which is the basis for this bullying, this bigotry, this racist behavior, defaming American soldiers most recently, who sacrificed their lives on the battlefield, defaming them, saying that they were Muslim and that they had no right to be in the military or wearing a uniform, or slander similar to this. That the position of Donald Trump as a misogynist, saying things against women, being manipulative in reference to women, and attacking women, as was the case numerous times in interviews during his campaign, and the authoritarian nature in which Sanders attacks almost anyone who he considers to be in opposition to his own positions. This is a personality flaw that he has demonstrated on numerous occasions. And the problem, of course, with this is that personalities of this type have been examined by psychologists numerous times, most effectively and most seriously in a set of experiments at Yale University in 1962, which became known as the Milgram experiments, because they were created, created, structured, and then conducted by Stanley Milgram, a psychologist and part of the Department of Psychology at Yale University. These experiments documented the authoritarian personality, and we have from Pennsylvania State University, the Behavioral Sciences Department, a documentary about these original and very effective studies on authoritarian personality. The experiments were conducted, as I said, in 1962. They have been repeated time and time again throughout the United States and in many foreign countries. All of the experiments that were run under the same question and under the same blind studies, in other words, with the person being examined not knowing that they were actually the subject of the test to whether or not they were authoritarian in nature and following orders provided by someone simply because they were wearing a white coat. Being authoritarian in personality is a character flaw because it allows a bully to determine what is right and what is wrong. So without further ado, let us get a look at these experiments by Pennsylvania, from Pennsylvania State Archives in reference to the Milgram experiments of 1962 by Stanley Milgram.
It is May 1962. An experiment is being conducted in the Elegant Interaction Laboratory at Yale University. The subjects are 40 males between the ages of 20 and 50 residing in the greater New Haven area. They were obtained by a newspaper advertisement and direct mail solicitation. The subjects range in occupation from corporation presidents to good humormen and plumbers, and in educational level from one who had not finished elementary school to subjects who have doctorate and other professional degrees.
Let's see right here. Now, both of you have been paid, so let me sit right now. So let me say that the checks are yours simply for showing up at the lab. And from this point on, no matter what happens, the money is yours. I should like to tell both of you a little about the memory project. Psychologists have developed several theories to explain how people learn various types of material. Some of the better-known theories are treated in the book over there, the teaching and learning process by Cantor. One theory is that people learn things correctly whenever they get punished for making a mistake. A common application of this theory would be when parents spank a child who does something wrong. But actually, we know very little about the effect of punishment on learning because almost no truly scientific studies have been made of it in human beings. For instance, we don't know how much punishment is best for learning. Now, we don't know how much difference it makes to who's giving the punishment, whether an adult learns best from an older or a younger person himself, and many things of this sort. So what we're doing in the project is bringing together a number of adults of different occupations and ages, and we're asking some of them to be teachers and some to be learners. We want to find out just what effect different people have on each other as teachers and learners, and also what effect punishment will have on learning in this situation. Therefore, I'm going to ask one of you to be the teacher here this afternoon, and the other to be the learner. And the way we usually decide is to let you draw from these two pieces of paper on which I've written the two positions. If this is agreeable with both of you, we can do that. The other. Would you open those and tell me which of you is which, please? Teacher. All right, now the next thing we'll have to do is set the learner up so that he can get some sort of punishment. So learner, would you step out here with me, please?
So the experiment has been set now. The two individuals who have returned have come to this experiment, answered the newspaper ad, have now been told that they will be part of an experiment, and one of them is the learner and the other is the teacher. What is unclear in the experiment is that the teacher and not the learner is the one who is a subject of this experiment. In other words, it's not an experiment as it's said it would be about learning. It's an experiment about the authoritarian nature of the individual who has drawn the slip of paper saying that he is the teacher. He is the subject of the experiment. And as the experiment continues, it will become clear whether or not he has an authoritarian nature in his personality due to the experiment and how he conducts himself, and not the learner. So without further ado, let's get back to this question.
Step right in here, learner, and have a seat there. You can leave your coat on the back of that chair if you will to take right off. That's fine. Have a seat right here. Put yourself right up to the counter, please. Teacher, you may look on if you'd like while we get set up in here. Would you roll up your right sleeve, please? Left sleeve. That's fine. Now what I'm going to do is strap down your arms to avoid any excessive movement on your part during the experiment. Is that too tight? Okay. This electrode is connected to the shock generator in the next room. And this electrode paste is to provide a good contact to avoid any blister or burn. All right, now let me explain to you, learner, exactly what's going to happen and what you're supposed to do. The teacher will read a list of word pairs to you like these. Blue girl, nice day, fat neck, and so forth. You are to try to remember each pair. For the next time through, the teacher will read only the first word or the first half of the word pair. For example, he will say blue. And then he'll read 4 other words, such as boy, girl, grass, hat. Now your job is to remember which one of these 4 other words was originally paired with blue. And you indicate your answer by pressing one of these 4 switches. Now can you reach those all right? That's fine. Now if the first word I just read, boy, had been paired with blue, you press the first switch, and this will indicate to the teacher that you thought it was the first word. If you thought it had been the second word, girl, you'd press the second switch, and so forth for the third word, the third switch, the fourth word, the fourth switch. Now if you get it correct, fine. If you make an error, however, you'll be punished with an electric shock. So of course it is to your advantage that you learn all these word pairs as quickly as possible.
I think so.
Do you have any questions now before we go into the next room?
No, but I think I should say this. About 2 years ago, I was at the Veterans Hospital in West Haven. And while there, they detected a heart condition. There's nothing serious, but as long as I'm having these shocks, how strong are they? How dangerous are they?
No, although they may be painful, they're not dangerous. Anything else?
No, that's all.
All right, teacher, would you take the test and be seated in front of the shock generator, please, in the next room? This machine generates electric shocks, and if you press one of the switches all the way down, the learner gets a shock. When you release it, the shock stops, you see, like that. The switch will remain in this middle position after you released it to show you which switches you've used on the board. Of course, if you were to press any one of them again, the learner would get another shock.
All subjects are given identical instructions and a sample shock.
The machine is now on. To give you, the teacher, an idea of how much shock the learner is getting, we think it's only fair that you receive a sample shock yourself. Are you agreeable with this? All right. Would you pull up your right sleeve a little bit, please? All right. That's fine. I'm going to ask you to close your eyes and estimate the number of volts you receive in the sample shock. Do not open your eyes until I tell you to do so, please. If you close them now. Okay, you may open your eyes, and using the voltage scale here, would you estimate for me the number of volts you receive, please? You may also use the verbal designations, slight, moderate, strong, so forth, to help you. A number, please? Would you? About 75. No, actually, there's 45 here. Although it may seem stronger because of the electrode paste, which provides a perfect contact. All right, let's go on to our instructions. We will begin with this test. You will read each pair of words in this list once to the learner until you've read through the entire list. Direct your voice toward that microphone as the rooms are partially soundproof. After you've read through the list once, you'll go on to the next page. And here, starting from line A, you'll read the word in large letters, along with each of the other words in the line. For example, in the first line, you read blue, boy, girl, grass, hat. Now, after you've read the four choices, the learner pushes one of the switches on the board in front of him, and the number he has selected will light up in this box, 1, 2, 3, or 4. Now, if he gives the correct answer, you say correct and go on to the next line. The correct answer is underlined and is also indicated in the right margin. Yeah. If he were to indicate the wrong answer, you would say wrong. Then tell him the number of volts you're going to give him. Then give him the punishment. Then read the correct word pair once, and then go on to the next line. For example, if he indicated 3 for blue, you would say wrong. 15 volts. You press and release the switch. Read blue girl, and then go on to the next line. Right. Now, each time he gives a wrong answer, you move up one switch on the shock generator. And it's important that you follow this procedure exactly. So to help you, let me go through it again very quickly. I would suggest you read the list and the test at a brisk pace to keep it moving. And of course, we'll begin with 15 volts for the first wrong answer. Okay? Do not begin until I say ready, begin, please. Attention, learner. Your teacher is about to begin the test. Try and remember the word pairs. Ready? Begin, please. Blue girl. Nice day. Fat neck.
The early stages of the test pass uneventfully.
Incorrect. We'll now get a shock of 75 volts. Soft hair. He kind of did some yelling in there. Continue, please. Incorrect. You'll now get a shock of 105 volts. Hard head. Just how far can you go in this thing? As far as is necessary. What do you mean, as far as is necessary? Complete the test. I sure don't know the effect of this thing, and I'm a little skeptical about electricity. The experiment requires that you warn the teacher. Please continue. Incorrect. 150 volts. Sad face.
Wait a minute. That's all. Get me out of here. I told you I had heart trouble. My heart's starting to bother me now. Get me out of here, please.
Continue.
My heart's starting to bother me. I refuse to go on. Let me out.
I think we have to find out what's wrong in there first. The experiment requires that you continue, teacher. Well, the experiment might require that we continue, but I still think we should find out what the condition of the gentleman is. As I said before, although the shocks may be painful, they're not dangerous. Look, I don't know anything about electricity. I don't profess any knowledge, nor will I go any further until I find out if the guy's okay. It's absolutely essential that you continue. Well, essential or not, this program isn't quite that important to me that I should go along doing something that I know nothing about, particularly if it's going to injure someone. I don't know what this is all about. Well, whether the learner likes it or not, we must go on until he's learned all the word pairs correctly. Well, you can sure have your 450 back. I didn't want it anyhow. I intend to get it to some charitable organization, but I wouldn't go in with it. The 450 is not the issue here. That check is yours simply to the lab. It is essential that you continue the experiment. No, it isn't essential. Not one bit. You got no other choice, teacher. Oh, I have a lot of choices. My number one choice is that I wouldn't go on if I thought he was being harmed.
teacher was, of necessity, placed in a difficult predicament, and steps had to be taken to assure his well-being before he was discharged from the laboratory. After an extended discussion with the experimenter, a friendly reconciliation was arranged between teacher and learner.
There you go. Better now? Much better. That's good. I'm glad to hear that.
Wrong. Hair. 75 volts, Jim. You don't know.
Please continue. Cool.
Wrong. Head. 105 volts. Wrong. Wet. Wrong. It's horse. 150 volts.
Experiment. That's all. Get me out of here. I told you I had heart trouble. My heart's starting to bother me now. Get me out of here, please. My heart's starting to bother me. I refuse to go in. Let me out.
Continue, teacher, please. Go on. The next word is sad.
Well, I'm not going on if he refuses to do it.
The experiment requires that you go on, teacher.
If he refuses, I won't.
Whether the learner likes it or not, we must go on until he's learned all the word.
Take the check back. I'm not going to hurt the guy.
No, the check's not the issue. It's absolutely essential that you continue.
Well, he don't want to. I refuse to.
So you have no other choice. You must
Yes,
go on.
I have a choice.
That is, if you don't continue, we're going to have to discontinue the experiment.
We'll have to. He says cut it out. After all, he knows what he can stand. Right, if I took that thing, the slight one, it was enough for me. I wouldn't want to be getting that every time I got a wrong answer. That's my opinion. That's what I'm going to stand on.
How do you feel?
How do I feel? He was getting a shock. I feel all right.
I'd like to ask you something. At one point, you were doing something a little unusual. Were you laughing at something at one point?
Yes, I was. At first I was laughing at him, and I heard him yell, ouch.
Why do you think you were laughing?
I don't know. I thought it was funny, I suppose. And then I got to thinking, when he said, no, that's enough, he had enough, so it wasn't funny to me then.
One might suppose that a subject would simply break off or continue as his conscience and temperament dictate, yet this is very far from what happened. There were powerful reactions of tension and emotional strain in a substantial portion of the teachers. One puzzling sign of tension was the regular occurrence of nervous laughing fits. 14 of 40 subjects showed definite signs of nervous laughter and smiling. In the post-experimental interview, subjects took pains to point out that they were not sadistic types and that the laughter did not mean they enjoyed attacking the learner.
I'd like to tell you a little more about the experiment. First of all, the gentleman there was not being shocked. He got no shocks whatsoever. Do you think he was?
Certainly I did. In fact, I tried to get my finger off the button as fast as I could.
No, he wasn't being shocked at all. And the main purpose of the experiment was to see how you would react to Mr. Williams' orders. Whether you would take them or defy his authority or what.
I defied it.
Except you did. Why didn't you go on?
To hell with him. Who the hell is he? As far as I'm concerned, see, right?
That's nice. Good ashtray right over there.
He's not telling it. In my mind, I was hurting that guy. If I had to continue to hurt another human being, I don't believe in it.
No matter what he had said.
No matter what who said.
Mr. Williams.
I would ask Mr. Williams or anybody else.
How did you feel about Mr. Williams?
I didn't. Never gave him a thought. You mean I didn't like him?
Well, how did you feel about it?
Oh, I didn't even think about it, quite frankly. I don't care who he is, you or the president of Yale or anybody else.
One aim of the research was to study behavior in a strong situation of deep consequence to the participants. This approach meant that we had a special obligation to protect the welfare and dignity of the persons who took part in the study. Before they left the laboratory, subjects were assured that the victim had received no painful shocks, and equally important, they were reconciled with their victim in an atmosphere of friendliness. After the completion of the experimental series, subjects were sent a detailed report of the results and full purposes of the experimental program. A formal assessment of this procedure points to its overall effectiveness. The victim was an accomplice of the experimenter. The drawing was rigged so that the naive subject was always the teacher and the accomplice always became the learner. The victim, according to plan, provided many wrong answers. His verbal responses were standardized on tape, and each protest was coordinated to a particular voltage level on the shock generator with the aid of indicator lights. The experimenter, who was provided with a similar indicator panel, took notes on the subject's performance. He recorded any
So interesting, of course, in this exceptional series of experiments, and the results can be read. Unfortunately, we won't have time to continue this evening to come to a conclusion. The results of the Milgram experiments were that the vast majority of individuals who were told to continue administering the shocks did continue to administer the shocks up until a nearly fatal or fatal doses, and in spite of the reality of the learner protesting being shocked. The two candidates that were shown as refusing to go forward were the exceptions. The reality is, and has been shown through the Milgram experiments to be the case, that individuals confronted with an authoritarian personality in the vast majority of cases will continue to go forward with the demands of this authoritarian individual, as was the case in the Milgram experiments. Unfortunately, this is the reality in the 21st century as well, and with an authoritarian individual such as a general or an individual like Donald Trump, the vast majority of those receiving his orders would continue. We'll be speaking about this in the future. Thanks for joining us, and have a pleasant week. Bye.